is Dr. Anaita Udwadia Hegde. I'm a pediatric neurologist affiliated to the Jaslok Hospital and Research Center. I'd like to start with a saying that children are not mini adults. Okay, while we have conditions which are very similar to the adult population, the presentation, the fact that the age is different, the weight of the child is different, the way the child progresses with the disorder, and most important, we are working with a developing brain. The brain is a fascinating organ which develops and grows almost 80 to 90% in the first 4 to 5 years of life. That is the age when neuroplasticity, or the ability of the brain to change and make circuits and develop, is at its maximum best. So that is the time we need to encourage, nurture and develop this brain and protect it likewise from neurological conditions, from things which may adversely affect brain development. As a pediatric neurologist, I see a host of neurological conditions, the commonest being epilepsy. Pediatric epilepsy has a spectrum of different forms of epilepsy as against an adult, which we will discuss at a different time. The other conditions we commonly see are cerebral palsy, children who have motor disorders, which is usually associated to birth-related problems or any problem to a developing brain in the first few years of life. They may or may not have intellectual disability with them, sensory issues, behavior issues, and epilepsy as part of the picture. Behavior conditions is a huge spectrum of what we see, and particularly autism. The incidence of autism today is almost 1 in 60. That is very significant. We are seeing more and more of autism on a daily basis, and while the whole world doesn't know what causes it, we are getting closer to understanding the etiology as well as tailor-making certain treatment options for them so that we can make them integrated and have a better life. We have neuromuscular disorders where muscle, nerve development, damage to them either genetically, degeneratively, or any of those causes are addressed. We would like to highlight spinal muscular atrophy, which is the new entity which everyone is so aware of today, where because of gene therapy we actually have a cure for the first time in medicine for a condition. It's a degenerative disorder which, if not treated, we would tend to lose the child over a period of months or years. But today we have a cure. So if you know any child with SMA or spinal muscular atrophy, please see that they get referred to a pediatric neurologist at the earliest. Genetics has changed the way we are able to treat our children today. A large chunk of neurometabolic or genetic conditions start in the pediatric age group, in the younger ages, infancy, childhood, and now that we have genetic identification and diagnosis, we can do what's called precision medicine. That's once you know how the gene works, you can actually tailor-make the treatment so that you are addressing the primary cause of it rather than giving something which is like a balm, which is a broad spectrum treatment. So you have conditions such as GLUT1 deficiency, which is a transporter deficiency of glucose into the brain, and the treatment is something as simple as the ketogenic diet. And it can change the child's life, and he can be a normal child as against having severe disability if not identified. So genetics has really changed the way we do neurodegenerative, neurometabolic, and because of the high rate of consanguinity in our country, we see a host of these conditions, particularly in children. Autoimmune disorders, stroke, and brain-related tumors are similar to the adult conditions, but stroke in children has a totally different cause, and likewise the treatments are very different. Oncology or tumors in the brain, the spectrum of tumors in the brain are different, and you do realize this is where a developing brain makes a big difference. When to do radiation, what are the drugs that we can use so that we spare brain development as much as possible so that the child can continue and live a normal life. Headache, something as simple as headache. You would think headache is only in adults. That's not so. Children get headache very often, and I would urge parents not to ignore this headache in your children, because it can affect academics, it can affect mood, it can affect their confidence, their integration into schooling, and these are very integral parts of a child's development which forms the framework of how he perceives himself in the future. So psychology of a child is very important, and don't push off the headache saying and give a tablet and say it's just, you're a child, just bear with it. Movement disorders, we have children with a whole host of movements. Tic disorders, Tourette syndrome is one of them, where they have hyperactivity with tics. We can help them with treatments and counseling and behavior therapy. Infections and acute neurology, children who come with brain infections, meningitis, tuberculous meningitis, viral encephalitis. COVID has taught us, it's shown us so many patients with viral encephalitis, and touch wood, they've come out, most of them with good outcomes, and simple things like head injuries which need to be acutely managed, and again keeping in mind brain development. With this, I would like to end and say that we would be happy to support and help in the treatment of any children with brain and neurological disorders, and feel free to contact us, and we look forward to supporting you. Thank you.